Greetings, greetings, greetings. Good afternoon. I am Nicole Everett, the host of Conversations with Nicole. And this is one of our vaccination conversations, a series of talks that I'm having with trusted community voices here in Tallahassee, Florida, around the coronavirus and the COVID-19 vaccines. So, over the past few weeks, I've had President Larry Robinson from FAMU, Dr. Temple Robinson from Bond Neighborhood Medical Center, as well as Pastor Judy Mandrell and Marcus West and Claudia Blackburn from the Florida Department of Health, Leon County. So today's special guest is the CEO of Neighborhood Medical Center, Miss Jeanne Freeman. Welcome, Jeanne.
Good afternoon. Thank you for having me.
Thank you for being here. So, for those of you who may be just joining us for the first time, this is an interactive live. So, I encourage your questions and comments, and we'll definitely try to address them. So, put them in the chat, and we will definitely take a look at that. So, Janae, for those folks who may not be familiar with you, just give them just a little bit of background about you and how you came to be the Chief Executive Officer at Neighborhood.
I am a social worker by trade. I'm born and raised in Fort Lauderdale, Florida. Like most that come to Tallahassee, I came here for school and I never left. So I am a third generation Rattler, very proud of that. I must say I'm also a Seminole as well. But just here in Tallahassee, I came to Neighborhood in 2011, working in the role of a case manager. And then the opportunity for leadership positions presented itself, and I took advantage of that opportunity, and here we are today. So just a social worker trying to make some impacts in our community.
Love it, love it, love it. So you've been CEO since 2016.
Yes.
And I'm sure that before we jumped on the live, you told me that Neighborhood has been around since 1994, which I was not aware that it has such a long history in the community. So I know you've made an impact, during your tenure.
Yes, since June of 74. 74, we've been
I'm
around.
sorry, 74. Yes, June of 74. My bad. Yes,
Yes,
74.
yes.
So yeah, no, that is a long run in the community and quite commendable. So tell the folks like who Neighborhood serves. For those who may not even know about Neighborhood Medical Center, who you serve, who your typical constituent is, like male, female, black, white, that sort of thing.
Well, our Neighborhood Medical Center is a federally qualified health center. We have had that designation from the federal government since 2014. We are definitely excited about that because it allowed us to expand our mission of primary care to other people. We others that we weren't reaching before. So we're able to provide access to healthcare services that so many people in our community need, regardless of their ability or inability to pay for those services. Our services, we provide care to people who are insured, uninsured, underinsured. We do offer services on a sliding scale for those people who are in need of that program. Yeah, it works out for everyone. There are nominal fees for our services, and we won't turn you away based on your inability to pay for those services. So for more information about that, you can visit us at neighborhoodmedicalcenter.org. Neighborhood provides primary care, mental health services, behavioral health. We are doing OBGYN services and dental. We have 5 locations across Tallahassee, a location in Havana, and we're also opening a new location on the south side in the old Hancock Bank building right off of Orange and South Monroe. So we're definitely excited to get that location open toward the end of this year.
Oh, exciting. Was not aware, and I know exactly where that is because I also live on the south side. When is that scheduled to open?
Later, by the end, we're hoping before the end of the year. The pandemic kind of slowed down our process in renovating that building. So now that things are coming back around, we're on track for hopefully the end of this year.
Okay, good deal. Good
We're
deal.
excited. We're excited to have our own space.
Nice, nice, nice. So tell me from a 2020 standpoint, who you serve, mostly male, mostly female. What are some of your demographics?
As of 2020, the majority of our patients were Black females, African American women. A little over 8,000 of those patients were women that we served last year. The remaining of those were male. We had about almost 14,000 patients that we actually physically put our hands on for primary care services last year. So a little over 8,000, about 8,700, if I'm correct, were Black women, were females, and then the majority of those were Black females. After African Americans, Caucasians were our next highest group of patients served. We also provided care to our LGBTQ community. We provided care to different races in our community. We don't turn anyone away. We're happy to see any and everyone. We make sure that our services are culturally competent and very easily accessible. And we do have a pediatric population of patients as well. We have about 1,500 pediatric patients. We have a pediatrician on staff and a pediatric nurse practitioner to help. Their specialty is focusing on taking care of children in primary care settings.
Awesome. So just a whole wealth of services for
Yes.
the entire community.
Yes, definitely.
So let's go to 2020, March around the 14th, 15th, we get the news that there's a pandemic and there's a shutdown. Tell me about the impact on neighborhood and how you all kind of put a plan in action to serve the community.
It was definitely a quick plan. I can remember when we had 8 cases in Leon County. I remember we had a staff meeting and our chief medical officer, Dr. Foster, was talking to us about the pandemic, and I think that was the end of February. And I think there were 8 cases, and we were just like, what does this mean? We didn't know much then. How is this going to affect us? And so we were instituting different protocols on how we were going to interact with patients, how patients were going to come into the clinic, ensuring that we were able to socially distance, have masks for people to wear when they did not have any available to them. So it was definitely a 180 in how we were doing things. Our schedules had to be reduced some so that we can account for people being socially distant, so we can account for the pregnant women that we take care of. One of our locations, we actually stopped providing primary care at that location so that we can make sure that pregnant women were isolated from other patients who were coming in for sick visits. It really just changed the way we practice healthcare at our health center. So it was definitely interesting. And shortly after March, we got the word that from the governor's office that dental services were going to be limited to only emergency services. Mm-hmm. So dental is a huge portion of the patients that we take care of on a daily basis. We don't want our patients or anybody in our community going to the hospital for dental pain. We would like for them to come here, get preventative care, and we can help take care of those issues when they arise and hopefully before they arise. So dental was put on a halt for almost about 5 or 6 months that we were only able to do emergency dental. So that was definitely a change in how we were operating as a health center. But we're definitely glad to see the end of 2020, moving into vaccinations, still doing COVID testing, but we're still wearing masks at our health centers, asking patients to make sure that they come in with masks. If they don't have them, we have masks at every one of our locations. We're screening patients as they come through the door because we want to make sure we keep our staff safe. We want to make sure we keep the patients safe. It's just an environment of safety, and making sure that everybody knows that is very important to us here at Neighborhood.
Now, you all had been administering tests back, in 2020. When did you all start that?
I think we started testing right in March.
Okay.
We started testing right in March, and it was definitely a challenge because at that time we weren't getting lab results back as quickly as we are now. I can remember some of our first COVID tests taking almost 2 weeks to get the PCR results back from the lab. And that's a long time. By the time we were getting results back, people were kind of coming on the other side of COVID. So now we're at a point where we're still doing testing. So if you definitely are in need of a test, we are an option for you. But now the lab results are taking no more than 48 hours, 2 to 3 days at the most.
Okay.
So that's definitely an improvement, but it was definitely a struggle during the beginning of the pandemic as it related to getting PCR tests back. And not only are we doing the PCR test, we do have rapid testing as well.
Okay. Yeah, I was just going to ask you to clarify that.
Mm-hmm.
The PCR is a bit more in depth, right?
Yes,
Okay.
yes. And you send that off to a lab to be processed. The rapid test you can do in-house, just like you would do a finger prick or A1C test. You can do that right in-house. It takes about 15 to 16 minutes to run the test, and it lets you know if there's a positive or a negative result. And the difference between those two is with a PCR, it's a little more in depth. A rapid test, we like to do those if we know if the exposure has probably happened at least 5 days. It'll give you a much more solid result.
Gotcha. Now talk about how many tests you've administered thus far.
It seems like we were testing at one moment every weekend, every day here at the health center, because we were doing testing outside. But we did a little over, I want to say it was a little over 4,000 or right under 4,000 tests. And I'm sure if you talk to my team, it might be more than that.
Probably feels like more to them.
Yes, doing so much testing. And it was a scary time because, we just didn't know what we were facing. And I do have to give a shout out to the staff here at Neighborhood, especially those who were out in the community and testing, and here at our locations testing. They did it without any hesitation, taking care of the people that we serve. And that's definitely that was commendable. It really was commendable. They are definitely healthcare heroes. So I do appreciate the team here at Neighborhood.
Awesome. So tell me about any impact that the virus has had on your team or, on you. I think those personal stories kind of get lost because as a healthcare provider, you're out here in the field trying to make sure that the public is safe, but you are a human being as well, and you are impacted. So talk about the impact on you or your team personally.
It was definitely it was different. It was like nothing else that I think that we've gone through as healthcare providers or just human beings, in our lifetimes. We had a lot of staff members. We had a lot of people who were impacted with COVID. We had some team members who were diagnosed with COVID. We had some team members who lost family members to COVID. We had some people who they dropped someone off, a loved one off to the hospital, and they never saw them again.
Yeah.
And not only was that hard for our team members, but that was hard for us to witness and live through that with them, because that was devastating to see people hurt that way. Grief was something that we really had to try to make sure everybody was doing okay. We had a couple of closures because we had exposures in some of our centers, and we wanted to make sure that we tested anybody who came in contact with someone who had a possible exposure. So it was a lot of adjusting and making sure we keep up with the latest science and CDC guidance. Our medical director, Dr. Foster, definitely stayed on top of things with updating our policies and procedures and making sure that, we screened patients and told them what our efforts were to keep them safe and our staff safe. So it was a difficult 2020. Personally, I had family members and friends who were affected by COVID in some rough ways. It was difficult for me personally. I had a baby during the pandemic. I was pregnant. So, coming to work and still being in that environment was definitely scary. So it was a difficult time for all of us as a community. So I'm glad that we're on the other side of what we hope to soon be normal, and that's definitely due to vaccinations. This is serious.
It is. Thank you so much for sharing those stories, because I think, we sometimes overlook in the midst of us trying to get our health care taken care of, or getting tested or getting a vaccine or what have you.
Hmm.
Those who are providing or
Oh
administering
yeah.
those tests, they also are impacted by it in a, in a
And it was
different way.
scary. It
Yeah.
was scary, if someone came in, I don't think we'll ever look at a sneeze the same again, or a cough or a fever. So, in the back of your mind, you're like, okay, hey, what's going on? Are you
Mhm.
coughing? So it was a lot. It was a lot of emotional duress that healthcare providers had to deal with and still have to deal with. And, that lingers on, because having to watch what COVID did to our world, our society, our community locally. That was a hard pill to swallow.
Mm-hmm. For sure, for sure. So let
Mhm.
me pause here for a moment. We're about halfway through, and I just want to, for those of you who may be just tuning in, I have talking with me today Miss Jeanne Freeman, the CEO of Neighborhood Medical Center, right here on the South Side in the Bond neighborhood in the South Side of
Mhm.
Tallahassee, and we're
Yes.
talking about their services as well as the coronavirus and vaccination. So in January, I believe
Mhm.
vaccines kind of rolled out.
Yes.
So tell me about, that action plan in terms of you all rolling out vaccines and what you're currently offering.
Whew, when January hit, it was almost like a whirlwind again, because we were still testing. We did not want to take the emphasis off of testing. We wanted to also make sure that we were right there at the forefront with vaccinations. And I definitely must give another shout out to TMH, who made sure that we had vaccinations to vaccinate our staff. And that was amazing of them to do. TMH is a great collaborative partner. So we were able to get our staff, those who wanted to be vaccinated, get our staff vaccinated immediately, and then start to vaccinate our patients in the community that we served. We started doing vaccine clinics. I think we started out with maybe one or two a week at our Orange Avenue location, and then that just kind of turned into doing vaccines almost every day.
Mhm.
We were trying to educate, reduce vaccine hesitancy. We had some wonderful nurse practitioners that were on the grounds with us doing vaccines every week. They're still doing them. So, I mean, we couldn't have gotten this far without them and some of our other clinical team members, just making sure that they were there to educate our community about how important it is to receive this vaccine.
Mhm.
Um, yeah, I know you and I talked earlier. This shot is the best shot we have at getting back to some sense of normalcy. So if you have questions, reach out to us. That is why we're here. Contact us. Reach out to us on Facebook. We are here. Stop by any of our health center locations. Ask us any questions that you need to know, and our providers will make sure that they give you the best clinical advice that we can.
Awesome. Thanks for sharing that. So, talk about the vaccines. I mean, I know that it's been out in the community that there are three, but just give a
Mhm.
rundown of what they are and the frequency of the dosage and what folks can kind of expect.
So right now, we do have all three of the vaccines that are available here at Neighborhood. We have the Moderna vaccine, which is a 2-dose vaccine. You get the first dose, and then 28 days later, you get your second dose. We also have the Pfizer vaccine. So get your first dose, 21 days later, you get your second dose. The Pfizer vaccine is available to anyone 12 years of age and up. Moderna is still right now at 18 and up, but they have also submitted a request to the federal government to be able to provide that vaccine to adolescents as well. So we're hoping to hear some news on that in near days. So, and lastly, we have the Johnson and Johnson vaccine, which is a 1-dose vaccine. So we have all three vaccines here. Our providers are very well versed and educated on the vaccines. They can explain anything about them to you. Just please give us the opportunity to talk about it. I know some people are still hesitant about it, but if you ask questions, you will get the answers, and you can make some educated decisions about your healthcare outcomes. And that's what this is all about.
Okay. So, any advice that you would give for folks that are preparing to get the vaccine? I know that there, as you've mentioned, there's some hesitancy. There may be even some fear because some people don't like shots. So, what advice would you give folks that are concerned or fearful or, to prepare?
Definitely talk to your healthcare providers. That's why they're there. They were there before COVID. They were going to be here after COVID. They are one of the best resources that you have available to you. Talk to them about what you can expect. Some people do, when they take the vaccinations, either first dose or second dose, have some cold-like symptoms after that, and that's just an immune response. That is what your immune system, we're hoping that it does if you do get the vaccination. So it's completely normal, lasts no more than usually 24 to 48 hours. When I took mine, I was like, okay, if I do have these symptoms, it's better than COVID. It's giving me a shot at living. It's protecting, I work in healthcare. I don't want to bring anything home to my young children. I still have 2 children who are not able to be vaccinated right now. So that's what we have to think about. We have to not just think about protecting ourselves, but protecting the little people in our lives. Our children are precious to us, and it's our responsibility to protect them. So think about it that way.
Yes, think about it that way. And then, so you mentioned vaccines for youth. Have you all been administering vaccines for the, is it 12? It's 12 and up, right?
12 and up, yes, with Pfizer. And we definitely have. We did a pop-up clinic at Rickers High School. We also have a health center location on site at the school. So we popped up at Rickers, the vaccinations in the evening. We have a second dose clinic coming up. We have our patients who are bringing in their children to come and get vaccines. Our pediatric patients are coming to get vaccines. It's amazing how word of mouth and a trusted voice will help you make an informed decision. Mm-hmm. So when we have patients come in or people in the community, because we're not just vaccinating our patients, we're vaccinating the community. When they come in and they ask questions during our vaccine clinics and they talk to our providers, they're like, okay, well, I'm okay. Well, let me call my son and let him come up here and get the vaccine. Let me call my son and tell him to bring my grandkids up here. So, that's how we're going to save each other with this pandemic. It's just about sharing that knowledge and making sure that everyone understands and makes educated, informed decisions. Once you're educated about this, sky's the limit.
Now, for those that are 12 to 17, a parent has to be, or guardian must be present.
Parent or guardian must be present because there is a consent form that has to be signed with before we administer that vaccination. Mm-hmm. So definitely, parent must be present.
All right. Just wanted to make sure
parent or guardian. Mm-hmm.
Folks are aware of that the child can't just walk up themselves and by themselves, but they do have to have a parent or guardian present.
And with every vaccination, we're going to give you an information sheet so you can take that information home, reference it, look it up, call us back if you have questions. We want you to be informed about the decisions that you've made regarding your health care.
Absolutely. So it's been said that the vaccine may last maybe 3 to 6 months. Do you think that we may be put in a place or position that we will have to get maybe boosters, or it may be something like the flu shot in terms of, flu shots are given annually? And I know you don't know per se, but just speculation, because that's the way I'm thinking it's going to wind up.
If I had to speculate, I would say so. I think it's going to be just like the flu shot in which you get a booster or a vaccination on a yearly basis. I think that may be where we're going. But of course, that is all speculation. But from what I've been reading and the research that I've done, it looks like it might be headed that way.
Mm-hmm. Okay.
Yeah,
I think so too.
Like I said, this shot is a shot. It's a shot at getting back to normal. I haven't seen my family in over a year. It was a lot to be pregnant and not see anybody. I'm popping up with the baby now, and everybody's like, "Who is this baby?" So think about all the stories that everyone has about not being able to see their family members or be able to see their grandparents because they're in a nursing home, or it's just it was just too dangerous before we had the vaccination. That vaccine is changing things for us now. So please just do your research. I respect the vaccine hesitancy, but I also respect the education that comes along with it. You know, get educated about it.
Okay. Very good. We do have a question from Tiffany Hill. She said, what are the suggestions for those of us who have been hospitalized for previous vaccines that would like to get vaccinated?
What we're telling our patients is to have a conversation physician so that they can you all can talk about their process and figure out if this is something that you should do or you should not, but it definitely needs to be a conversation that you have with that primary care physician.
Yeah, I think you can't say enough the importance of talking to that healthcare provider. I do have a girlfriend who has had an allergic reaction to vaccinations, and she's been advised not to get vaccines.
Yeah. And there are some people like that. There's quite a few people who are like that, but you definitely want to make an informed decision with your healthcare provider about that. Mm-hmm. Definitely.
Absolutely. So tell me about some of the outreach that you have coming up. I know I see you in the community almost every weekend, but talk about, where folks can see you in the community that might be closer to coming to one of the satellite offices.
So we're definitely going to be at Greater Love Church on Orange Avenue this Saturday, providing vaccines to the community. Please reach out, come talk to us. If you're hesitant, we will have nurse practitioners on site who can talk to you, sit down, answer your questions, and help you make an informed decision. So that's where we'll be this weekend. We have a vaccine clinic this afternoon at St. Eugene Church, which is right behind Bragg Memorial Stadium. So we'll be there. We have one simultaneously this afternoon in Quincy as well. So we're trying to be out as much as we can so people can see us. And when they see neighborhood, think about healthcare right in your neighborhood. We're coming to you. We've partnered recently with Second Harvest of the Big Bend in their neighborhood empowerment series. So not only do we do food distributions once a month at our Brevard Street location, we're joining with Second Harvest and other partners that they have identified to do pop-up outreach and education events in the communities. So I think last weekend we were in the Nicole neighborhood. This was our 6th one last week, and we have, I think, 3 more coming up during the summer. So we've partnered with the Institute for Nonprofit Innovation and Excellence to do vaccines coming up. So if you need outreach and education, reach out to us. We have an excellent outreach team. Reach out to Joseph Ward, Matea Sweet. They can definitely help you. If you have a health fair, we would love to be a part of that. We've also started drive up or pop up HIV testing. So if you're interested in having that done, please give us a call. We don't want the pandemic to be a barrier for access to care. If you are in need of services, reach out to us and we can set up something where we can come to you. We do have a mobile unit that you will see in the community. It's here. We have another one that is being renovated right now. So our mission is definitely to meet people where they are.
And you all do a great job of doing that. I tell you, you all's outreach is like second to none. Because
thank you.
See y'all everywhere, everywhere.
That's a good thing.
It is a good thing. And you all have a great team that is getting the word out about what you do and serving the people, which we need. So thank you. All right. So Greater Love, Orange Avenue this Saturday, and I think that's from 8 to noon?
Yes, 8 to noon.
Okay. And then throughout the week, every day
right here at our Orange Avenue location. We started back up our Saturday clinic. So every other Saturday we're here providing primary care on the weekends. We're moving slowly but surely back into doing that every weekend. We want to make sure that if you're working every day of the week, putting off your health care is not an option. We want to make sure that you have options to get the services that you need on a routine, regular basis.
Awesome. Well, anything else you wish to share in closing?
Visit us at neighborhoodmedicalcenter.org. If you know someone in need of OB services, GYN services, primary care, pediatric services, case management, mental health, outreach, or education, we are the place for that.
Absolutely. Well, I definitely got to thank you for your time and want to also say just well done. Keep up the great work in the community. We appreciate you and all you do, your wonderful team, your staff. I have been to the center for the happy hour that you all
Yes,
do.
our healthy happy hour. Mhm.
Yes. So, and I find that to be quite interesting, some of the topics that have been covered. So, keep up the great work. We appreciate you. And again, thank you for your time today.
Thank you. And please check out our podcast as well. I
Yeah.
can send you a link to that because we have amazing podcasts. In lieu of the pandemic, our happy hours turned into our healthy happy hour via podcast. And Joseph Ward, Matea Sweet, Elena Steeple, they've done an amazing job with doing our podcast. I was honored to be interviewed last week. So now I feel like I'm a celebrity now that I got in line and I'm on our podcast. So please check them out. There are amazing topics that will enhance your life. They really will.
You are a celebrity. I'm just wanted to continue more conversations with Nicole. Look.
And now I have made it big. Okay, I have arrived.
Yes, ma'am. Yes, ma'am. All right. Well, we're gonna close this out. I want to thank the viewers for being on here. I see all the great comments coming in. They really are supporting you, Janae.
Well,
So
thank you, everybody. We appreciate it. We are here for
absolutely.
you all.
All right. So actually, we'll be on tonight talking to Dr. Andrea Frau with TMH at 5:30. So check out that conversation as well. All right. We'll see y'all tonight.
Thank you.
You're welcome.